Welcome back to our channel. Today in this video, we are going to talk about causes of burning feet and treatments, physical therapy for burning feet, and how to reduce the pain. Some folks start to experience persistent foot burning. They progressively develop it. It typically begins at the bottom of the feet and gradually moves up to the tops of the feet, ankles, legs, and knees. Both sides are impacted, yet occasionally it might only be one side. They may experience tingling, numbness, electrical shocks, pins and needles, or even alternate between searing and ice-cold agony, which is quite uncomfortable. Today, I'll go over some of the reasons why people get burning feet, as well as the remedies we employ to treat them. So let's discuss scorched feet today. One sort of pain is burning. Neuropathic pain is the underlying mechanism. When the nerves that transmit pain signals to the brain have a lesion or another condition, it results in neuropathic pain. In a different video, I go into greater detail on neuropathic pain. The axons of the neurons produce the lengthy structures that make up the nerves. Here, near the spinal cord, is where the neuron body is located. The axon is the neuron's long projectile. The body of the neuron supplies food to the axon. Some neurons are therefore exceedingly lengthy. Take a look at this foot-bottom innervating neuron. Due to its body's proximity to the lower spine, nutrients must flow all the way to the foot. This axon can grow to a length of 3 feet or around 1 meter in some individuals. Since the axon's nutrition is so crucial, the sickness that damages it will start by damaging the longest nerves first. The most prevalent disorders that harm the long axons are those that include alcohol-related neuropathy. The nerves are damaged by alcohol, but alcohol consumption also interferes with the metabolism and absorption of a number of vitamins vital to nerve function. In a different video, I describe the effects of alcohol on the nervous system. Diabetes. Sometimes the first sign of diabetes is the neuropathy it causes. Diabetes is a condition that causes excessive blood sugar levels, which harms the nerves. Once more, the longest nerves in our body are the first to be impacted. The odd feelings begin to expand up to the legs and knees if the diabetes is not effectively treated. These are the axons that go to the foot. The lengthy nerves in the hands may also be impacted. Additionally, the person will no longer be able to accurately perceive cutaneous sensations. We carry out 2-point discrimination as one of our exams. The skin of the hand typically has the ability to distinguish between 2 locations that are relatively near to one another in terms of distance. The person loses this skill when diabetes damages the nerves. Similar to this, if you touch someone's skin with 2 different pencil tips, they will be aware of 2 people touching them. However, a person with diabetic neuropathy will only experience one of these 2. Kidney disease. Kidney disease is another issue that results in burning feet. Blood is filtered by the kidneys, which also eliminate toxins and extra fluid. These wastes accumulate and harm the nerves and other organs when the kidneys are not working properly. Kidney failure can be brought on by a number of illnesses, the most prevalent of which are diabetes, hypertension, glomerulonephritis, recurrent kidney infections, and blockage of the kidneys. Vitamin insufficiency. Vitamin insufficiency, especially vitamin B12, is one of the other contributing factors. Regarding vitamin B12 and neuropathic pain, view the other video. Burning in the feet can also be a symptom of hypothyroidism, a thyroid hormone deficit. Check Watch my other video on hypothyroidism. Burning feet are a symptom that can potentially be brought on by HIV and AIDS. Additionally, the patient can experience numbness, a lack of sensations, or strange sensations. Another factor contributing to burning feet is a side effect of some chemotherapy medications. Sometimes we are unable to identify the reason of the person's burning foot. Idiopathic peripheral neuropathy is what we are referring to here. Before we continue with the video, don't forget to subscribe to our channel for more educational information. Thanks. An explanation of each of these causes of burning feet is provided in a free handout that can be downloaded by visiting the description of this video below. You can talk to your doctor about them. The cause must be addressed in order to treat burning feet. Please keep in mind that this video is primarily for educational purposes and is not meant to substitute medical advice. If you have burning feet, you should consult a doctor before continuing. If there is an emergency, call an ambulance or proceed to the closest emergency room. If HIV is the culprit, effective antiviral medication may help with the symptoms. If alcohol is the culprit, quitting drinking may ease the symptoms or stop them from getting worse. If low thyroid hormone levels are the root reason, regular hormone replacement therapy is required. However, there are rare instances where the cause is unknown or unavoidable. Then we might turn to neuropathic pain treatments such as opioids, anticonvulsants, and antidepressants, and physical therapy. Physical therapy is a further treatment that is efficient and is commonly recommended by your doctor. In order to determine how neuropathy is affecting your quality of life, physical therapy takes the patient as a whole into account. The physical therapist collaborates with you to determine the best course of action following a thorough evaluation. Therapy includes exercises and balance training on a large scale. Exercises will help you stay strong and prevent tightness, loss of range of motion, and other problems. Additionally, soft tissue work relieves pain and helps to loosen up tight tissues. Gait and balance exercises help reduce the risk of falls and future injuries. Transcutaneous electrical nerve stimulation, or TENS, suppresses pain-inducing nerve signals. It is a treatment that works well and is simple to administer at home. In order to help you live the best possible life, physical therapy also assists with educating you about your neuropathy. Cold laser therapy. OLT is yet another more recent procedure, low-level laser therapy. The procedure is non-invasive and it doesn't get warm. In this type of phototherapy or photobiomodulation, biological changes can be induced to help with the onset of pain alleviation. According to research, cold laser therapy can help with wound healing, reducing muscle and tissue tension, and relieving neuropathic discomfort. When you get physical therapy at therapy achievements, cold laser could be used as a form of treatment. Additionally, we advise that person to stay as active as possible. Exercises and physical activity are proven to be effective in lowering blood pressure, regulating blood sugar levels, and disengaging the mind from discomfort. Send this video to everyone you know who suffers from scorching feet. Subscribe to this channel now. Have a good one.